The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
One woman at a time, a great crusade helps women protect themselves against breast cancer.
Every time we can break down a barrier, we save a life.
Food poisoning, you can avoid it. Silent but deadly, how can you spot the ulcers you can't feel? Smart pills, what's in your medicine cabinet may get a whole lot more effective. All this and more coming up today on Today's Health.
What you don't know can't hurt you. Well, you probably heard that old adage before, but now forget it. 1 out of 8 women in this country will develop breast cancer during their lifetime, and surviving that disease may depend actually on what they do know. I'm Kathleen Sullivan, and this is Today's Health. Before this 30-minute show is over, 10 more women will be diagnosed with breast cancer. And today, we'll join nearly 500,000 women who are mounting a nationwide woman-to-woman crusade to raise breast cancer awareness and empower women to take better care of their health. They're trying to make a difference in the fight against breast cancer, one woman at a time.
Answer the door, open your mind, and pay attention. This woman's on a crusade. She's one of over 400,000 representatives from Avon Products who are giving personal testimonials, raising money, and distributing information about breast health and the importance of early detection. It's part of the nationwide breast cancer awareness crusade launched by the company in collaboration with the YWCA of the USA and the National Alliance of Breast Cancer Organizations. This pink ribbon pin costs $2. It's worn as a symbol to encourage breast cancer awareness and to instill hope for fighting the disease. Already over $10 million has been raised by selling these pins and keychains. As of October 1995, a pink ribbon pen will also be available. All proceeds from the crusade go directly to funding many different types of community outreach and intervention programs.
Effective outreach needs enormous amounts of funding because you really need to provide women with transportation, child care, companionship if they're frightened, and this means you need to have people in place to do those jobs.
To date, Avon representatives have distributed over 32 million educational brochures printed in English or Spanish to educate women about early detection.
There is a tremendous need for this type of outreach. For women over 65, Medicare will help pay for a mammogram every other year, yet only 37% of women take advantage of this benefit. This crusade is about empowerment. We help women overcome the barriers of language, fear, lack of transportation by providing answers, access to service, and encouragement.
If every woman was aware of breast cancer and practiced good breast health, we might save more than 10,000 lives a year. Now watch this.
Arlene became aware of the importance of early detection and went for a mammogram. She discovered she had breast cancer.
I was devastated. I thought my world has come to an end.
Fortunately, Arlene discovered her cancer early and was able to save her breast. Early detection made it possible for her to have a lumpectomy rather than a mastectomy. It's part of the Encore Plus program launched by the YWCA in partnership with the Centers for Disease Control and Prevention. Encore Plus is funded by over $5 million raised from the sale of the pink ribbon breast cancer awareness pins. The program links the YWCA's woman-to-woman outreach and education programs with medical service providers funded by state and local health departments in the CDC's National Breast and Cervical Cancer Early Detection Program. These federal dollars are used by state and local health departments to bring breast cancer screening to women at the local level. Reaching low-income, minority, older women, and other medically underserved women is a key priority for this program.
Encore Plus is a great model that shows how a private company, the federal government, and a not-for-profit organization can work together and really make things happen.
In addition to outreach, many Encore Plus programs provide survivor support groups. If you or someone you know needs to discuss coping with breast cancer, call the Why Me National Breast Cancer Organization at 1-800-221-2141. Encore Plus support groups include exercise to help women regain their physical mobility. And the Survivors Network helps them cope with all the psychological and social aspects of breast cancer.
when you go through a crisis. It helps to know that there are others to help you there.
From our grandmothers, we got the idea that you should not touch any part of your body, and that is a big, big mistake.
The crusade marches on. Pills are getting smarter. Could you have an ulcer and not know it? When we return on Today's Health.
Discovering a lump in your breast, boy, that can be frightening, but don't panic. About 80% of breast lumps can be benign, but they should all be evaluated by your physician. For more information about breast cancer, early detection, and coping with this disease, call the National Cancer Institute at 1-800-4-CANCER. And now here's more.
When was your last mammogram? If your answer is never or over 2 years ago, you could be long overdue. We lose over 46,000 women a year to breast cancer. Mothers, sisters, daughters, friends, and lovers, all of them. And it doesn't have to be that way.
My doctor never ordered one.
I already have too many medical expenses.
I can't do that.
Not talk about it is like something that you don't supposed to talk.
I can't see, so I can drive.
All women are at risk for developing breast cancer, but regular screening and early detection can dramatically increase your treatment options and chances of survival.
Sometimes the difference between getting a woman to go to the doctor or to get a mammogram can be as simple as offering to watch the kids for an hour or so, giving her a ride to the doctor. Sometimes offering her information in her native language is the key.
The great thing about the crusade is it teaches women all 3 steps of screening: regular mammograms, annual clinical breast exams, and monthly breast self-exam.
It's important to do breast self-exams so that you know what's normal for your own breast. Then, if you feel some changes, you can get it checked out by a doctor.
Funds raised from the crusade keep outreach programs alive and effective. They help community workers do whatever it takes to get women to the medical services they need.
I was hesitant to have a mammogram until my mother's sister died of breast cancer. And I was convinced after that I needed to go and have myself checked, and I did so.
From our grandmothers, we got the idea that you should not touch any part of your body, and that is a big, big mistake. Every time we can break down a barrier, we save a life.
It's still a medical mystery. No one knows what causes breast cancer, and many cases occur in women who have no identifiable risk factors. Each woman must stand guard for her own body, and programs supported by the Breast Cancer Awareness Crusade are showing them how.
Breast self-examination is not enough. You need to follow a 3-step plan for early detection, and that is doing your breast self-examination once a month, getting yearly clinical breast exams, and getting regular screening mammograms based on your age and your family history.
These women are learning how to begin a comprehensive early detection program. It's part of the Encore Plus program, which is funded through the Breast Cancer Awareness Crusade. A mammogram might identify a lump smaller than a pea. At that stage, surgery to remove the lump rather than the breast could take care of your cancer for the rest of your life. Over 90% of women whose breast cancer is detected early survive the disease. With early detection, breast conservation surgery is possible. But as the size of the growth increases, your treatment options decrease. Early detection now. That's a key phrase that drives the Breast Cancer Awareness Crusade, making women aware of what they can do right now to stay healthy.
This isn't a project to fund future-oriented research. The Crusade's singular aim is to help save lives today. One day, research will bring us a cure, but there are things women can do today, and our goal is to help them do those things.
Avon's Breast Cancer Awareness Crusade is the largest cause-related marketing effort ever staged in America to fight this illness. And these delicate pink ribbons are providing the means to confront a very tough disease.
It must have been something I ate. I've been up all night. I can't come into work today.
The meal was to die for, and they almost did. Food poisoning. You can prevent it, but how? Next on Today's Health.
No No matter how great food tastes, if it's not properly prepared, foodborne bacteria can give you a nasty case of food poisoning. You can't see, taste, or smell those germs, but their calling cards can be painfully apparent. Here's how to avoid them.
Her cooking was murder. In 1500, palace gossip accused Lucretia Borgia of making herself a merry widow by feeding her husband a feast seasoned with arsenic. That could have been a premeditated act, straight from the pages of Machiavellian deceit. Today, food poisoning may be accidental, but the consequences can be almost as dramatic. The way we handle eggs, fish, raw meat, and poultry can be a recipe for disaster. Your hands can transfer foodborne bacteria from raw foods to kitchen surfaces or even other foods. And your hands aren't the only way to contaminate the food you eat. Let's first focus in on the problem. Raw meat, poultry, fish, and eggs can carry invisible foodborne bacteria like Staphylococcus, Salmonella, and E. coli. Select only products whose expiration dates have not passed. Prevent cross-contamination by not allowing the juices from raw meat, fish, and poultry to touch other food products. Always buy perishables last. Get them home as cold and quickly as possible.
In your kitchen, the only good germ is a dead germ. Refrigerate or freeze perishables, cook your food until it's done, and keep your hands, dishes, utensils, and all surfaces clean and sanitized. Here's more.
It must have been something I ate. I've been up all night. I can't come into work today. Oh.
Joe's got a case of food poisoning. Like many others today, he won't be at work. Lost wages, lost business make up only a fraction of the staggering costs due to foodborne illnesses each year. Dinner tasted great. What could have gone wrong? Let's go to the videotape and see. Last night, Joe prepared broiled chicken with a salad. The germs that made him sick could have come from many places. Stop here. Joe's hands have chicken juice on them. They can transfer bacteria from the chicken to any food or surface he touches. The plate with the raw meat is now contaminated. It shouldn't be used again until it's thoroughly washed. Barbecue sauce splatters on the countertop may carry bacteria from the raw meat with it. Soap and water alone won't kill them, but an antibacterial kitchen cleaner, like this one from Lysol, can kill many germs on handles, dials, and surfaces. Joe takes the time to cook the chicken completely and at the right temperature until done, but stop! Here's an important note. That fork and plate still have raw chicken juice on it. Any dishes or utensils used on raw meat, poultry, eggs, or fish should never be used on any other food product until thoroughly washed. Joe also touched the handle of this oven with his dirty hands. That can be another path to cross-contamination. Microscopic foodborne bacteria can hitchhike their way into your system in many different ways. If we don't follow some easy guidelines to control them, we may have to learn the hard way.
You've heard "Don't worry, be happy." Well, in addition to being the words of a popular song, many people think those lyrics describe a pretty good defense against ulcers. Well, keeping stress low may help prevent some types of ulcers, but others can occur as a side effect from medications. Let's take a closer look.
Some people blame the kids, others claim it's work, and still others think they come from modern life. But no matter what causes an ulcer, when you get one, you know it. Not. There's one cause of stomach ulcers that allows them to sneak up on you. You may not feel the pain until it's too late. It happens as a side effect of medication called non-steroidal anti-inflammatory drugs, or NSAIDs, which are commonly used by people with arthritis. Aspirin, for example, is an NSAID.
Because NSAIDs are so wonderful at getting rid of pain and inflammation, these patients often have no symptoms of getting an ulcer. We call those silent ulcers.
The fact that the ulcers are silent makes them so dangerous, but there may be a technology that can help detect them before they become a serious problem. This lab technician is analyzing the results of an early detection test for ulcers discovered by researchers at the University of Calgary in Canada. Since you probably won't feel the pain of the ulcer if you're on the NSAID medication, your body can warn you in a different way. As in many cases, your urine can be the window to what's going on in your body.
Sucrose, which is a sugar normally not found in the urine, can be found in the urine in patients who have ulcers or lots of inflammation in their stomach.
When this test becomes available, people with arthritis using NSAIDs for their pain can keep a vigilant eye on their stomach. It may be a good way to spot a silent ulcer before it becomes a very apparent danger.
When it comes to ulcers, silence is not golden. It can be ominous. People who can't feel the pain may never know it's there until it becomes critical. How many people are at risk for this problem? Probably a lot more than you'd think.
Unfortunately, silent ulcers occur many times all over the United States and Canada, where an estimated 40 million people suffer from the pain and discomfort of arthritis. As many as 20,000 people a year could die from the ulcer-related complications that can arise from NSAID medications. Right now, patients with an increased rate of risk can be protected by a prescription medication like Cytotec that can prevent stomach complications caused by arthritis medication. The NSAIDs reduce inflammation and decrease pain by inhibiting the body's production of a chemical called prostaglandin, which triggers pain and inflammation. In a normal stomach, prostaglandin also shields the lining of the stomach and intestine from stomach acids. Sucrose normally passes through and gets broken down in the small intestine into glucose and fructose. The NSAIDs inhibit the production of prostaglandin, and that imbalance allows the acids to erode the walls of the stomach and intestine. Ulcers form, and some of the sucrose from the GastroCheck early detection test spills out through the ulcers and winds up in the urine.
In order to tell whether there are holes or ulcers in the lining of your stomach, we have to be able to put sucrose into your stomach and look to see whether it leaves the stomach and appears in the urine.
We may not like it, but pain is a natural warning mechanism. If we put a gag on our pain, we'd better find another way to hear what our body is saying.
Prepare for the unexpected. Many communities and organizations offer free CPR courses that teach you how you should respond when someone else's heart stops. If you take the time to learn CPR, you could save a life, maybe even the life of someone you love.
Miniaturized, computerized, and transistorized medicine capsules with a built-in brain. Smart pills. Join us for a fantastic voyage when we return on Today's Health.
What's the big idea? Think small. Miniaturization often opens the door to new uses of existing technology, and now miniature computers, radio transmitters, and tiny receivers may actually make what's in your medicine cabinet a lot more effective.
Direct hit. If anything, the Gulf War showed us missile guidance capabilities that could pinpoint targets and all but read street addresses. For too long, however, that technology was limited only to defense systems. But now the developments for war have been applied to the science of saving lives. You're looking at a new generation of medication delivery systems called smart pills. Inside this capsule, developed by GastroTarget, you'll find a power source, a high-frequency receiver, a radio frequency transmitter, an organic gas generator, a balloon apparatus, and a polyurethane membrane containing the medication. The membrane ruptures to release the medication only when it reaches a pre-programmed location. A small computer contained in a vest worn by the patient tracks the capsule's journey through the digestive tract with the help of 8 miniature antennas that receive signals from the capsule transmitters. When the pill reaches its precise location, radio signals trigger the capsule and it releases the payload of medication. The spent insoluble capsule then continues its journey and safely exits the body with other waste. Target contacted, medication delivered.
A pill with a built-in brain. It sounds like something from a science fiction novel, but the potential rewards of being able to pinpoint areas for medication are very real. Let's follow a smart pill on a fantastic voyage through the human body.
Be in the right place at the right time. That's the secret to success in life and now in medication. The tracking system designed for these smart pills can locate the capsule's position inside the body to an accuracy of about 3 millimeters. Side effects are a huge problem with medications, and often they're caused because the body disperses the drug to many different areas other than what needs to be treated.
Having the ability to precisely target a disease site with a drug should dramatically reduce the side effects, increase the effectiveness of the drug, and possibly reduce the amount of drug required to treat a given illness.
FDA approval of this medicine delivery system should come within the next 2 years, and already researchers are working on applying the smart pill to improve the effectiveness of AZT in people with AIDS. Other applications could include using the capsule to take samples from the digestive tract or to medicate pinpointed problem areas for people with ulcerated colitis and Crohn's disease.
When you consider that over half of the people in this country over the age of 65 take up to 8 prescriptions annually, having the ability to develop oral medications that are precisely targeted should reduce the amount of drug required to treat a given illness, and that could lead to a huge savings in the annual prescription bill for this country.
Even more important, better delivery should mean better treatment and recovery. That could realistically translate into billions saved from reduced hospital stays and medical expenses. The capsule's in place, the medication's released. The pill with a brain, it may be coming soon to a system near you.
Of all the material possessions we can claim, nothing is more important than our health. And sometimes it's hard to remember that with all the excitement, stress, and activity in our lives. You might want to take a closer look at the way you live and what you can do to help yourself feel better and live longer. I hope this show gave you some good ideas. Join us again next time as we get right to the heart of matters concerning your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.